Welcome, Dr. Shetty, to Editor Speak. Sir, is using a pre-printed consent form to take consent illegal?
There is a judgment from the National Consumer Commission which has banned the pre-printed form, but fortunately the Supreme Court had granted a stay on this. It is not practical or feasible for a doctor to be writing consent forms. Even today in this digital world, it is not a practical solution. But consent has to be specific. It should mention the procedure which the doctor plans to perform. It should mention the risks and the complication. It should also mention any alternative protocols available. It should clearly specify the consequences of refusing to give consent in a language which the patient understands.
Right.
If after being given all this information, when the patient gives the seal of approval, it is a valid consent and a full consent.
Sir, any recent judgment to understand this better?
In a recent judgment from the State Consumer Commission, a ophthalmologist performed a procedure on a patient. Due to complication, the patient lost vision in that eye. The patient's relative filed a case of negligence against the ophthalmologist. They stated that intervention was performed without taking consent. In defense, the ophthalmologist stated that the patient had signed a pre-printed pro forma in his clinic which he has used with other patients. Much more than he mentioned that the fact that the patient was educated and knew what she was signing on the consent form. On perusal of the pre-printed pro forma, the court observed that the patient's signature was there on the consent form, but the consent form did not mention the complications. Much more than the consent did not mention the name of the intervention and also the risks associated with the intervention, much more than the fact that the patient may lose his vision if the complications occurs. This was not mentioned in the consent form. For this reason, the court said that this was an incomplete and invalid consent form.
Sir, any more important suggestion for our doctors who are watching this video?
My suggestion will be consent form should be filled up with a lot of diligence. It should be mentioning the procedure. It should mention the risk and the complication and alternatives specifically.
Thank you, Dr. Shetty, for your valuable inputs.
Thank you.